All right, everyone. Thank you again so much for joining us. We are excited to have you with us for the Program Quality and Alignment meeting this morning. We have a packed agenda, so let's kick it off with Melissa.
Great. Well, good morning, everyone. I hope everyone's doing well this beautiful spring morning. We have, as Christina noted, a very packed agenda with our preschool development grant taking up the bulk of what we're going to be focusing on today. So everyone should have received the minutes from the May meeting, and I guess that our committee members may vote to approve these minutes. So for those of you who are committee members, I'll take a motion for approving the minutes from May 10th.
We've actually got everyone muted, so since we're unable to unmute everybody at the same time,
okay.
We can just ask for people to send in any edits or changes that they have to the minutes during this meeting. And so at the end of the meeting, we'll call them approved. But we've got about 54 people, I think, on the webinar today, and so I just don't want to. We can't unmute everybody.
No, that makes perfect sense. Well, great. Well, great. Well, we are starting off today with the preschool development grant updates and scope of activities, and handing it off to Lindsay.
Awesome. And we'll get started with Lindsay in 1 second. I want to just share, too, that we have about, I think I see 54 people on the webinar. Rather than going and doing introductions or reading folks' names today, we've opened it up so hopefully everybody can see all the other attendees on the webinar. So when we send out those minutes, we'll make sure that all the names of all the people joining us today are included on that list. And then, yeah, I think we'll jump right in with Lindsay.
I apologize, everybody. I'm fighting a bit of allergies or cold or something that's going around. If we want to forward our slides. Next one, please. All right, so on your screen, just a reminder of our overarching goal for the preschool development grant and our key deliverable or outcomes that we'll be working towards in year 1, as well as hopefully years 2 through 4. We have a number of updates for the work that we're doing. The first one is we've completed the hiring for our PDG team. So last month, many of you met our early childhood mental health lead specialist, Lisa Schluter. This month, actually this week, we brought on our new early childhood workforce coordinator, Angela Benzekri, and I would love for her to share just some of her experience and where she comes from to support workforce projects under the grant.
Hi, everybody. It's great to meet you all remotely from the room here. And so I'm Angela Benzekri. I actually just moved to Colorado from North Carolina several months ago. I'm coming from a large Head Start program in the state of North Carolina, actually the largest. And while I was there, we received an Early Head Start Child Care Partnership and an Early Head Start Expansion Grant. And with that came a lot of workforce needs. So we actually were working within our community and the state on a number of workforce initiatives for early childhood education to make sure we weren't creating a vacuum as we had needs at the Head Start level. We also had a number of other programs. We had Nurse Family Partnership. We were our child care resource and referral agency. We had 2 gen programs dealing with immigrant refugee families, as well as workforce development for low-income families. Since we knew that we were providing services to their children, we also were providing services to the parents as well in terms of GED, work readiness, and things of that nature. So we were working with a number of community partners to really implement new programs and support our community and the workforce needs.
Okay, great, thanks, Angela. So a lot of Angela's work will focus on some of our activities under sharing best practices and supporting work groups. They'll be looking at credential competencies and qualifications for our workforce, as well as engaging with a number of the workforce initiatives across the state to help us elevate innovations, opportunities to pilot, or other information that will feed into our years 2 to 4 application, as well as our strategic plan. So welcome again. All of our vendors who were participating in our competitive procurements have been selected, and so we're largely in a contract process. Heather, are you meeting? Mm-hmm. Okay, sorry. So we're now engaging in the contracting process. We hope to have a number of our contracts issued by the end of next week for key activities, including needs assessment, strategic planning, and evaluation. And then the rest of our contracts should be completed by July. So we'll be engaged in all activities by mid-July. The year 2 to 4 renewal grants. So we received guidance last week from our federal project officer that they still intend to release the year 2 to 4 application in August. However, it's going to change and look differently from previous direction and the legislation. So instead of having one funding opportunity announcement, the federal government will be releasing 2. One for states that had submitted their needs assessment and strategic plan at the time of the application, and one for states that have not. So Colorado, based on our updated timelines, will actually be working on the second application for the announcement for states that have not submitted their work. And finally, we received some federal guidance around flexibility in how we utilize our funds. So because a number of states are operating on a later timeline, the government's no longer requiring us to complete a needs assessment and strategic plan before we move into our activity 5, which is quality improvement. So as you may recall, Colorado has one defined activity under that strategy under that activity, which is improvements to our Colorado Shines website. So we'll be pursuing approval to begin that activity this summer. And then we also want to be able to look at our budget. So we know we have some cost savings through contracting that will allow us to begin to explore some other opportunities for spending these funds. And so what we'll be doing in July is looking at where we stand in terms of our budget and where we might have some opportunities to implement recommendations that may have come out of Activity 4, sharing best practices, or that may have been reduced or cut when we received a reduction in our award. So those decisions will be looked at internally in July, and then we'll be excited to share those out for some feedback. I do want to remind everyone that those decisions for spending those funds have to align with the funding announcement and the legislation. So that means we cannot create new programs, we cannot expand access to slots or create new slots. It's really building on what exists and what we spoke to in our original application. All right, next slide, please. Can we go to the timeline slide, please? Thank you. With the changes in federal guidance, we've made a few adjustments to our timeline. So looking at this, some notable changes are in August, we're still planning on receiving and applying for the renewal grant. In October is when we anticipate to begin to share out initial findings of the needs assessment to the Program Quality and Alignment Subcommittee, as well as the full ECLC and any partner initiatives using work from the needs assessment. So for example, as we look at Senate Bill 63, the Strategic Action Plan for Infants and Family Child Care Homes, we'll begin feeding some of our findings and data into that initiative. And then finally in December, that is now our target date for sharing the final needs assessment report, strategic plan, and evaluation plan with the Program Quality and Alignment Subcommittee, with the ECLC for endorsement, and finally with the federal government for approval. Okay, next slide, please. So before we move into how we're going to start accomplishing this work, I do want to review some of the deliverables and the charge that we were given by the federal government to complete this work. So you'll hear today about the needs assessment, and we just want to remind folks that the rationale for this, or the purpose of the needs assessment, is really to be the foundational piece of our strategic plan. So we want to identify areas that we can strengthen. So looking at existing programs, looking at key populations so that we can maximize the availability of programming in the early child care and education system. So to that end, we've defined a few key topics. First will be early care and learning needs for families. The second is other service needs for families. So what do they need not only inside early care and learning environments, but outside of those environments as well? And finally, what services are necessary for child care providers? So how can we strengthen business practices that allow them to operate, such as the family child care home space? Or how can we ensure that they have access to early childhood learning and development resources that allow both formal and informal environments to really support the learning and development of young children? Next slide, please. Our next key deliverable will be the strategic plan. Excuse me. So again, we really want a plan that looks at what currently exists and facilitates collaboration and coordination among these programs within the mixed delivery system across the state, so that we're preparing low-income, disadvantaged children to enter kindergarten. We improve their transitions into the school system, and that we're really enhancing the quality of the care and learning supports that they receive. So within this, what we'll be looking at is more efficiently using federal, state, local, and non-government resources to align and strengthen the delivery of existing programs, coordinating delivery models and funding streams within our mixed delivery system, and finally, developing recommendations to better use existing resources in order to improve the overall participation of children in a mixed delivery system of early childhood care and education programs, improving the quality of programs while still maintaining the availability, expanding parental choice and knowledge about what exists in the system, and again, enhancing school readiness for children. Okay. And next slide, please. And finally, we move into our evaluation plan. So we need to develop a plan to look at the process, costs, and outcomes of implementing our strategic plan. Along with this, we're also going to be exploring any barriers that currently exist to data collection and how we would need to overcome those. So one of the other activities the state is engaged in currently is the development of an IT strategic roadmap, which is looking at the existing IT system and where we want to go within the next 4 years. So what do we need to enhance, or what do we need to build to be able to facilitate this work to happen? Next slide, please. So as we think about these activities and the work that our partners will be engaging in, we want to share a little bit of our thinking around our key populations. So within our proposed scope, we're looking at the following populations on the screen. So we've defined some categories that may define families, and we realize that families will not be siloed within these categories, but really exist across these. But these are the guardrails or the framework that was set in the Every Student Succeeds Act legislation, the PDG funding announcement, and the state's application. In addition to families, we'll also be looking at the provider population. And so we're looking at individuals who are providing care, whether it be formal or informally, and then other service providers. So thinking about those other services that families need to be able to support themselves and their child. Next slide, please. And next, we want to look at the programs that we'll be prioritizing within this work. So we took the definition of the early childhood care and education system, again, from legislation, the funding announcement, as well as the application, to define which programs will be prioritized within our first round of really digging into the assessment and plan, as well as what programs are related to the early childhood care and education programs that need to be considered in order for that program to meet the targets and outcomes that we've set. And again, our partners will take a deeper, or kind of go in deeper into this work and talk about how we'll achieve that and how we might think about this as we move forward. So next, our partners. So you'll meet today the team from the Colorado Health Institute. they'll be leading the statewide Birth to 5 needs assessment. You'll also meet our team from Child Trends, who are working in partnership with Marzano Research and Early Childhood Milestones to lead our strategic plan. And finally, the Butler Institute for Families at the University of Denver will be leading the evaluation plan development, as well as focusing on one of our sharing best practices activities, analytics, which will tie in very nicely with our strategic plan and needs assessment work. So before we get into that, I just want to remind everybody that you have a very important role in this work, and that's why we're presenting this information to you today. We want you to be able to connect us to those key populations, engage us within that program space so that we can find the information that we need to have a really comprehensive needs assessment and inform a strategic plan that's responsive to the needs of Colorado. So to that end, our vendors or our partners will be requesting opportunities to meet with stakeholders. I feel like that's probably something you've heard a lot of us talk about. And so those who have submitted meetings, we will be sharing that information with our partners. But there may be other opportunities that you haven't thought about that they'll be sharing today. We'll also be putting out a survey at the end of this meeting with more opportunities to provide feedback. So please make sure that you take time to really review that and to share your thoughts because they are meaningful and will have an impact on this work. Finally, make sure you're checking in on the website. We post all of our information there, including a full list of our vendors and partners, updates about our team, and soon we'll be fleshing out where we're at in a number of the strategies that we've committed to under the PDG, especially those activities that were able to begin earlier this year. And finally, we have a new email address. So if you have any questions, feedback, want to share information with our team, just reach out to us at cdhs_pdg@state.co.us. And with that, I'm happy to turn it over to our partners. Yeah. All right, as we get settled in the room here, this is Christina. So just a reminder, we have everyone muted at this point. So if you have questions along the way, if you have comments, things you want to share, please use the chat box in the questions box and share those with our team. We can see those here. If you'd like to be unmuted, we can do that as well individually. So you can just type that in and then we can try and unmute you to ask any questions you have.
All right. Good morning, everyone in the room and on the phone. My name is Alex Caldwell. I'm one of the directors at the Colorado Health Institute. We are so excited and honored to be a part of this really stellar team of people doing really important work. So I'm just really excited to get to meet a number of the folks that I haven't yet met on the PQA. We've worked together in a variety of settings already. The Colorado Health Institute is a nonpartisan health policy research group that does a number of different, we've been working on a number of different issues over the last, since 2002, I think, on issues on the safety net to a broad variety of other issues in health. But one of the areas that I lead is behavioral health, and in that is early childhood mental health. And so I'm coming in with 3 years of experience kind of learning about that landscape, but we're really looking to you as some of the leads in this work, and I'm looking at the people in the room too, to help us inform this needs assessment to really characterize what are the greatest needs in childcare for Colorado. I'm joined here by my colleague today. That's not Leanna Major. That's on the agenda. Spencer, do you want to introduce yourself?
Oh, sure. Yeah, and I'm also not on the camera, so sorry about that.
Oh, yeah.
Hi, everyone.
Do you want to sit over here?
Oh, sure. Sure. I will get my screen time.
There you go.
Nobody gets to avoid the camera.
So anyway, hi everyone in the room and on the phone. I'm Spencer Budd. I'm a research analyst with the Colorado Health Institute. Alex and I will be leading this work from our side, and excited to be here to work with you all.
Yeah. And we're representing a team of about 27 statisticians, recovering journalists, people who are really very equipped to do some deep analysis of the landscape of childcare and early childhood environments, learning environments. But so in other words, we're sort of the tip of the iceberg, but we're just looking forward to sharing some of our approach today. Next slide, please. All right, so there's some animations here that I'm just going to kind of click you through, if that's okay. We'd first like to orient you to just our overarching approach. Then we're going to walk through some specific places where we're going to ask for your input. We have just, I think, 10, 15 minutes to walk through this needs assessment part. Then we're going to talk about the strategic plan. And then we're going to stop and kind of pause to look at some places where we really want to get your input. So just be ready for that. But first, sort of an overarching look at the assessment. Next click, please. So there's a series of questions that we're asking, and let's actually click once more. There's 5 questions, but I want to stop on these first 2 first, because I think this is really where the foundations of this needs assessment work. The first question is, what do we have? So with respect to, this is secondary data analysis, let's look at the administrative data out there. Let's look at the existing needs assessments that have been done already characterizing landscape, and let's synthesize those in terms of what are the programs out there, the ongoing initiatives, the dollars flowing through the state, the quality initiatives, because as we know, Colorado is a leader in this space, so let's start there. The second question is, what is enough? So what do we have is, let's say, supply. What is enough is, let's say, demand. Okay, so if we compare these two, we're going to start to characterize some of the biggest gaps in the state. So that's why I want to look at these 2 first. That second question of what is enough, the sort of demand question, is where we're going to be asking for a broad set of community engagement activities. So we're going to be going out and doing a series of focus groups, key informant interviews, and other sort of data collection to characterize this. We want to understand in those terms, what is the natural demand for early childhood services based on how many hours should they be open? How do we characterize quality? What kind of facilities do we need? And beyond that, even what do we need outside of those learning environments? So these sort of need and supply, the supply and demand question is how we're going to characterize this throughout. Questions 3 and 4, if you can click just 2 more times, that's where we compare questions 1 and 2. So that's where we say where, when we compare the supply and demand of our existing system, where is there not enough? So looking geographically, and who is not getting enough? So characterizing the needs based on that list of populations that you saw in the previous slides. This is where we sort of start to characterize the gap. So we're going to be doing a lot of modeling for this, but we'll also be using existing data sets from the Office of Early Childhood, from programs like Nurse Family Partnership, and from, of course, the qualitative data that we're going to be collecting throughout the state in close partnership with the strategic planning team. The last question I want to point out is, why is there not enough? This is critical. This is going to be one of the questions that we ask in sort of that synthesis phase. How do we characterize what is happening that results in these gaps? Is it a fact of access? Is it an issue related to market conditions and just inability of businesses to stay open, for example, in rural areas? Is it a licensure kind of workforce issue? These are the questions that we're going to need to drill down using people like those on the phone. We're going to be doing a series of key informant interviews. We'll supply what we can from existing needs assessments and literature review to help answer that. So that's sort of the arc of the story that we're going to be pursuing over the coming months together. And next slide, please. Let's look at the timeline. Okay. Yeah. Yeah, it's a great question, and I welcome those questions. Thanks for just pointing that out. We can have an informal discussion to be possible on a webinar, you know? So the level of detail provided in the needs assessment is still to be determined based on, you know, how we want to characterize this from available secondary data that's already available. Likely what we'll be doing is characterizing it in using our secondary data analysis at the county level and the census tract to the extent possible. We probably will be using qualitative data to characterize more city, neighborhood, community level information, but because our secondary data, such as from the American Community Survey and our existing Office of Early Childhood data, those are usually at or we can roll those up more at the county level. And so it's a good question. Likely the lowest common denominator will be county, and we'll be drilling down where we can using qualitative information. I know we're sort of on mute, but Heather, if you have further questions about that, I welcome those if you'd like to use the chat. Does that work? Okay. Let's go on to some of the key activities in our timeline. If you can go ahead and click through, that's fine. We're going to take two basic approaches I mentioned. One is secondary data analysis, and the next is primary data analysis. The secondary data analysis, that's ongoing. We're starting that process, and we're going to leave that kind of to the side for today's discussion, but just be aware that that's the modeling that we're going to be doing using existing data sets, using survey data to characterize what are the greatest needs and kind of existing services that are out there. The primary data collection and analysis, this is where we're going to need this group's help to characterize who are the right people that we should be starting with, what are the existing family meetings, parent meetings that exist. We don't want to recreate the wheel. How do we sort of leverage what's already there? We will be doing one, what we're calling a family data collection tool or approach. We're in discussions with some subcontractors and vendors to help us do that, to really characterize the needs, particularly from the more informal, not licensed exempt communities, as to what their natural demand of child care is going to be. But that is ongoing. The key informant interviews, likely we're going to use the expertise of people on the phone today, so we'll come back to you with that. But I bolded the family provider focus groups today because there are 30 of them that we want to conduct in partnership with the strategic plan teams, and we want to focus our discussion primarily there, since we'd like to start that in July. So if you can go to the next slide, and we'll just pause here. If you go on, that's fine. So in June, we're starting this work by establishing just what are our key questions, how are we approaching these 5 big, what do we have, what do we need, those big questions that we saw before, and we're collecting those secondary data to start that modeling exercise. July and August is really where we're going to be conducting the brunt of the primary and secondary data collection and analysis. And so that's where we'll be traveling around the state. We have a series of subcontractors to help us with that. And we'll be asking for your help connecting us to those groups so we get a representative sample to the extent possible. Go to the next. September and October is really where we align those findings with the strategic plan. That's where this work kind of comes to a point. We will be, that said, aligning the efforts, like the mechanism through which we're gathering this information, very closely with the strategic vendors. So I'm the strategic planning vendors. I'm looking here at Morgan. We have been in close contact for the last like 10 days. It feels like it's already been a month, but really working together to find ways that we can not recreate the wheel, use these focus groups sort of in conjunction, maybe even split up the groups so that it's like half needs assessment, half strategic plan. This is an example of how we're trying to align these and not over-sample. We're very conscious of that. And the last, if you go to that November, December time point, that's where we're anticipating completing this report, reviewing this with you. So we'll be most likely, when we think about where we're going to be asking for this group's help, we're thinking about July and August primarily, and we're thinking about that November and December time point where we come back to you with a report that we can analyze together. Lastly, if you go to that next slide, so this is where I'm gonna skip basically over this, but I want to just tee it up. If you can sort of click through, these are on the left-hand side. You can click once more, that's perfect. On the left-hand side are those family groups that you saw earlier, defined by the federal government on how we're approaching the needs of families in the state. On the right-hand side, we're going to come back to this, but these are some of our initial thinking with respect to where do we start with existing groups, existing parent communities, existing family communities, to start to characterize what are the greatest needs, what are the ongoing initiatives in the state. So we're going to come back to this, but I just wanted to tee it up as one of the asks for this group. How do we want to start? Who do we want to, what are the points of contact that we should be starting with? What are the existing meetings that you know about in the coming weeks that we should leverage, either through formal or informal focus groups? So just keep that in mind. And if you go to that last slide, these are the types of questions that we're thinking about. Which family groups potentially are missing? How are we going to prioritize, given our really tight timeline, provider and stakeholder engagement? And how else do you want to support? So there's a lot of ways that Lindsay already teed up, but we would welcome the opportunity to talk with you all about how you want to engage. So again, we'll come back to this, but there is my email that I think we're going to be collecting all of our feedback sort of through us, since we'll be starting the scheduling of those focus groups shortly. But all that to say, hold tight. We'll come back to this discussion in about 20 minutes, 15, 20 minutes. Okay. Any other questions coming in on the chat, or should we pause? Okay. All right.
Nothing yet. So why don't we move over to our strategic planning, and then, as you said, we'll have an opportunity to come back together and talk through both of you together. Thank you.
Morgan, do you want to switch? You feeling good?
I'm feeling good.
All
and
right.
Sarah's actually kicking us off. So she's not on camera, but she is on the phone.
Yes, wonderful. Can you all hear me?
We sure can.
Okay, great. If you want to go to the next slide, we can just jump right in. I think you can even go one next slide. We can go ahead and introduce our team. Hi, everybody. My name is Sarah Daly. I am a senior research scientist with Child Trends and serving as a project manager for the strategic planning work. I'm thrilled to be partnering with Early Milestones Colorado and Marzano Research. I'm sure you all know Morgan and Jennifer and Carrie, but want to give you all a chance to hear their voices on the phone and introduce themselves and their roles on this project. So Morgan, I'll turn it over to you, and then Carrie to introduce yourselves.
Sure. So this is Morgan Yankee. I am the Director of Initiatives with Early Milestones Colorado. And as part of this project, we will be leading the provider and partner stakeholder engagement. So really excited to be doing that. For those of you who may not be familiar with Early Milestones, since 2015, we've been working with state and local partners to advance innovative solutions that improve early childhood practices and policies. So had an opportunity to work with more than 42 communities across the state, and excited to expand our work as part of this as well. Also on our team will be Jennifer Sedrin, our Executive Director, who could not be with us today, so I'm here in her stead. As well as Karen Schrieweiler, who is a project consultant with deep expertise in maternal and child health, and Andrew Keating, who is our Senior Communications Manager. So they are both on the phone listening now. Carrie, do you want to introduce yourself?
Sure. Can you hear me?
Yep.
All right. So I am Carrie Germeroff, and I'm a managing senior researcher at Marzano Research. It's been in existence since 2008, and we're located in Centennial, and we do education research from basically prenatal through post-secondary, and we also hold the contract for the Regional Educational Laboratory for the Central States with the Department of Education. So I have the opportunity to work across many states around early childhood issues, and have worked with many of you all on things like the Colorado Early Learning Development Guidelines, as well as the Colorado Early Childhood Framework. So I'm just really excited to be a part of this team, and I'll just say we have a staff of about 20 researchers at Marzano who will be pulled in at various times to support us and this project. And I should also just say that Marzano is primarily responsible for coordinating and organizing the family engagement component of the strategic plan. So all that good stuff that Alex was just talking about related to the family engagement data collection, I am most interested in getting your feedback as well. So I'll turn it back over to Sarah.
Wonderful. Thank you both, Carrie and Morgan. And I was remiss in giving a little bit of context around Child Trends. For those of you who are not familiar with our organization, we are a national nonprofit, nonpartisan research organization that is based out of Bethesda, Maryland. And we work with states and the federal government on a variety of different topics related to child development. Our team in early childhood is about 80 people strong, and have worked are working currently actually with a variety of states on their PDG work. My personal experience in Colorado has been to be the principal investigator for the Colorado Shines validation study, and also the principal investigator for the Early Childhood Council evaluation that was conducted in 2016. So we're just really thrilled to be a part of this team and to continue to learn and work with you all. So before I turn it back over to Morgan and Carrie, I want to just give you a little bit of context about kind of how we are thinking about our approach to the strategic plan. If you want to go to the next slide. As Lindsay mentioned, the purpose of the strategic plan is to really outline a roadmap for how Colorado can move forward with facilitating the collaboration and coordination among existing early care and education programs across the state that are really designed to prepare low-income and disadvantaged children in their transition to kindergarten. So with that purpose in mind, if you want to go to the next slide, our goal is to be highly coordinated with the needs assessment team. As Alex just shared, the PDG Birth to 5 Needs Assessment is going to be identifying several key areas where an additional focus and attention may be needed to build a more robust and comprehensive early childhood system in Colorado that's meeting the needs of all children and families. So our goal with the strategic planning team is to identify the specific goals and action steps that can directly address the specific areas for improvement that are identified by the needs assessment team, so that we can be working with that ultimate goal of maximizing the availability of early childhood programs and services in the state. So we are absolutely going to be joined at the hip, so to speak, over these next couple of months. If you want to move to the next slide. Just to give you a graphic representation here of our two teams, certainly the Colorado Health Institute leading the needs assessment team. Their work is going to be informing our work and the strategic plan, and our work is going to be shared back with them, so that both of these pieces are going to be in lockstep as they're under development simultaneously over these next couple months. So just want you to know that we have some processes in place. We meet on a weekly basis so that our teams can be aligned, and both internally and then also with folks at OEC. So we have are developing those processes and communication tools to make sure that our work is coordinated at every step of the way. If you want to go to the next slide. I think it's also important, before I turn it over to Morgan and Carrie, just to share our general guiding principles for this work. So, really our goal in these next few months is to balance the need to be extremely comprehensive in meeting the criteria for the strategic plan, but while also leveraging the existing efforts to be sure that we can be expedient and efficient in this work and effective in developing a strategic plan that's really going to guide Colorado's work going forward. So with that in mind, our guiding principles are, of course, as I mentioned, to closely coordinate with the needs assessment team, to be sure that we are working off of the existing strategic plans that are already underway and making sure that we're aligning the work that has already been done, to be sure that we're not duplicating work, and we're really seeing the themes that emerge from those existing strategic plans to inform our thinking. We want to be sure that we're building on existing initiatives and groups and efforts that are already underway, so that we can be really efficient in gathering feedback and building our work plan. So we're going to be talking more about that with you all in just a minute to help have you all help us in our thinking there. We want to be, of course, inclusive of stakeholders across the early childhood system in Colorado, and we'll be asking for your input on those different groups that we should be reaching out to. And of course, guiding our work is thinking in a cross-sector way. We want to think about how this strategic plan can help to inform improved transition planning from early childhood education settings into the K-12 education system. And so being sure that we're covering our bases and being sure that we're thinking in a cross-sector and cross-systems way. If you want to go to the next slide. So today we'll just give you a quick highlight of our key activities for this work, really focusing on those first 3 data points on this slide. Carrie is going to talk about our efforts to analyze existing strategic plans and think about alignment of those strategic plans and our approach to engaging families. And then Morgan is going to be talking about our provider and partner stakeholder engagement processes. Of course, throughout that process, we're going to be synthesizing the data that emerge from all of these different efforts and making sure that they're coordinated with the needs assessment team as a couple of other key activities that are going to be happening over these next couple of months. So with that, I will turn it over to Carrie.
All right. Was there a question? Is that what you said? How does this align or potentially overlap with the plan required from SB 19 and SB 63? Yep. I'm going to repeat the question. I'm not sure people heard it.
Yeah, I can do that. So the question is how will the statewide strategic plan align with Senate Bill 63? So we are currently planning for that to be separate activities. So while the needs assessment, data collection, and development of those plans run on similar timelines, there will certainly be an alignment, but they will still be separate plans because the strategic action plan for Senate Bill 63 is very specific and submitted to the state legislature along with the report. So it's going to look a little different, but again, same data sources, same kind of look. We want to ensure alignment, so we'll just make sure that those processes run in tandem.
There was one more question about the migrant education program. I'm currently working on their service delivery plan. Would we be interested? I think absolutely. So if you can, are those links still open?
Yes. Okay. Yes. So we still have opportunities for individuals to submit any, any plans, reports, data that they're currently collecting, and the Office for Early Childhood is then forwarding that information on to our partners.
Okay, are you ready? Okay, great. Thank you. Can you go to the next slide? Wait, hold on.
We need to get
Wait, I think one more back. Okay, sorry. I had a little bit delay. Let's see. So one of the first things we'll go into a little bit more depth that Sarah was just mentioning is that we obviously want to build on what currently exists in terms of strategic plans, local and state level. And so you all have been asked to provide your strategic plans for a while now, and I think the cutoff is coming soon because we're eager to get started on our alignment work with those plans. So what we'll be doing is we'll be reviewing them, and for the extent to which they meet goals of the strategic plan, which would be to identify strategies for collaboration and coordination and quality improvement among existing Colorado mixed delivery programs. We'll be reviewing them against a number of criteria basically that are outlined in the strategic plan goals, and taking that review and trying to weed out some documents that may be more or less relevant so that we don't have a big pot, right? And then we will be comparing those for their themes and trends and content and gaps as they and how they align to the Colorado Early Childhood Framework. So using the framework as an anchor, again, to identify some themes and trends and strategies and where gaps may exist. And then this resulting analysis is going to help us to develop a set of draft elements that will really be used to kind of start the development of strategic plan. And along the way, we'll be infusing information from the needs assessment, particularly around the first two questions of what do we have and what is enough. And then feeding in the data that's going to be collected from both our family and non-family stakeholders through surveys and focus groups that both the needs assessment collected as well as what we'll be sharing that we're going to be doing. So that's one activity that will be kicking off as soon as we get a hold of all of those strategic plans very soon. So that's one of our first steps. You can go on to the next slide. So the family engagement portion of the strategic plan, very similar to what was shared with the needs assessment in terms of the groups. Obviously, there's a lot of overlap and we're coordinating very closely on this. But the goal for family engagement for the strategic plan is to identify strategies and opportunities to improve caregiver and parent participation in the birth through 5 system. And so we're going to do this through primarily surveys and focus groups. Not as many as the needs assessment, not 30, but we'll have our fair number. You can go on to the next slide. So one of the things we're really excited about is using Right by 3's Right by Text subscriber database to kind of float some of our strategies that might end up in the strategic plan. And so there's approximately, it's not 1,200, that's, sorry, extra zero, 12,000 Colorado parents that are currently subscribed to Right by Text. And they represent a wide geographic distribution, and so we're excited to be working with Right by 3 and to help distribute some of our survey questions in a very effective communication channel, as we've seen from the past. And we'll also be working with many of you, hopefully, to get the survey out to different organizations through websites or other listservs and newsletters that may be targeting the different family populations that we're trying to reach. We'll also do a series of focus groups, approximately 8 to 10, geographically representative, and the number will really depend upon the location and how much we're traveling. But you know, you put these in addition to the needs assessment group, and we've got a pretty wide coverage in terms of being able to collect information from families. And like Alex said, we'll really be trying to leverage and pool our resources to make sure that we're not oversampling, and that we have strategic plan questions being asked of the same individuals as receiving needs assessment as appropriate. So we're really trying to be very strategic and coordinated in our efforts here to engage families in this process. So that's pretty much the high level information on the family engagement piece. We're going to, once we finish our strategic plan overview, we'll continue into, as Alex was mentioning, a more deeper discussion, getting your input on how best to engage families and how can we, really make sure that we're reaching all of these different target populations. So with that, I'll turn it back over to Morgan.
Great. And I see we have a question around how will you ensure that the survey responses include people with limited access to technology? And I actually, if we don't mind holding off on that until we get into the discussion for input around how we're planning to engage more across both, I think we'll definitely make sure we address that then. So to supplement the work that Marzano is doing to engage families, Milestones will be reaching out to child care providers, both licensed, informal, and exempt, other service providers and systems builders across the 3 early childhood framework domains, so family support and education, health and well-being, and learning and development. And really want to make sure we're including state, local, and tribal agencies and using this to inform the strategic plan. So want to thank you all for the current list of innovative practices you've collected and sent. And please continue to send those, and we're definitely using those to inform the work we're doing. Next slide. So far, there have been more than 50 organizations, initiatives, and committees identified as key stakeholders. So we're tailoring our outreach based on 2 criteria. So really thinking about interest in investment, which you'll see on the left side of that 4 square, which is defined as the extent to which the stakeholder group has a vested stake in the PDG strategic plan and its outcomes. So thinking about a vested stake may be expertise, mission alignment, or financial alignment. And then also looking, you can see at the bottom there, necessity of involvement. And so that's really defined as the extent to which the stakeholder group's lack of involvement could significantly change the emphasis and outcomes of the strategic plan. So we're really going to be looking for information on what collaborations are already in place, where is there opportunity to facilitate more coordination, and how are families really being served, and where are there opportunities for improvement or expansion. So planning to do a variety of methods to inform that. And so you can see that high engagement group in the top right-hand corner. And I think this group, the Program Quality and Alignment Committee, is a great example of you have high interest in investment and a high necessity of involvement. So we're going to be doing 4 focus groups. We're planning to partner with this committee to do one of those focus groups. We're also partnering with the Early Childhood Council Leadership Alliance to do a focus group, as well as some other early childhood child care provider groups to facilitate those 4 formal groups. We will also be doing 10 to 12 key stakeholder interviews with that high engagement group. When we're thinking about proactive engagement, those may have lower interest in investment, and I want to be clear that's not because of necessarily lack of alignment or lack of commitment to early childhood. It may be geography, it may be time. So really thinking about informal providers or family child care providers who just don't have that same time to dedicate to this, but their necessity of involvement is very, very high. So for them, we are going to be doing a survey as well as some targeted communications, or you could consider that an informal focus group, where we're going to be asking to join existing meetings to ask some targeted questions to inform the strategic plan. Then we also know that we want to keep everyone informed and involved, so we will be distributing the survey broadly to all that are interested and all that need to be involved, as well as having some ongoing communications. So Sarah, did you want to talk us through the timeline?
Yes, exactly. So I think, as Lindsay had shared earlier in the meeting today, really our goal is to be in the depths of our data collection process throughout the summer, so that by the end of the August, early September, we can begin our data analysis and interpretation for the strategic plan. If you want to go to the next slide. We are expecting that we would then have an opportunity to vet the needs assessment and the strategic plan with all of the early childhood groups in Colorado by early fall of this year, and that we would be submitting our final drafts in December. So just at a high level, just reprising what Lindsay shared earlier today. And then here's our contact information. You'll have these in the slides if you want to be in touch. I will mention that we are going to be administering a survey after the meeting today that to further gather your feedback. So the survey will be available to you, but you also will have this contact information if you want to touch base with any of our team members. Please feel free to do so. And maybe we can then transition into kind of our discussion portion of the presentation. If you want to go to the next slide. So I believe Alex and Carrie and Morgan, you are going to be co-facilitating this portion of the discussion. So I'm not sure who wants to kick us off here.
Sure. This is really, we're excited about getting the opportunity for input and looking for this group to provide some feedback. So please use the chat box, the questions to type in thoughts and information. And so if you'll go to the next slide, these are some overarching questions that we want you to keep in mind as we're talking through these stakeholder groups. So really, we're going to share kind of some initial thoughts aligned with the populations that Lindsay identified early on in the presentation, and Alex and Carrie and I all kind of repeated it when we were talking about our part. So really want to understand who is missing, what groups would you prioritize to connect with, what's the best way to connect with these groups, and would you be willing to circulate a survey link to the groups that you're connected with? So helping us get that information out. So ask that you kind of keep those key questions in mind, and we can repeat them as we go forward, but that's really where we're looking for your help. And these are also the same questions that will be in the follow-up survey that you get. So don't feel like you have to provide input right now. You'll be getting these slides, you'll be getting a follow-up survey, and we really are looking for you to be a thought partner and help inform what we're doing. So I will turn it over to Alex to talk about the family engagement piece.
Great. And Carrie, I'd welcome your, co-facilitation as much as you want to come into this, since we've been working on this together. You can should we look at these questions first? Did you just want to? Sorry, I was looking.
I went through them.
Okay, great. I was just noticing we have a couple questions coming in on the chat.
Oh, yeah.
So maybe should we just, we'll just pause for a minute and look at these because I think they're relevant. One is from Scott, thank you. The question is, will the needs assessment interviews include conversations with officials from relevant state agencies and others in the executive branch, philanthropic leaders, key policymakers, especially regarding state structural needs such as systemic alignment and coordination, data infrastructure and capacity, regulatory barriers? What a great question, Scott. I love the way that you characterized this, and that is the intent. That is the intent for certainly the needs assessment, and you can imagine there's going to be lots of sort of strategic planning questions and discussion and sort of hypothesis testing that should happen in those discussions. A key component of this work and what we really are focusing on today is the family voice, and so that's why you're not hearing us use some of those terms or like mentioning those audiences today so much, since in some ways that's a little bit easier, like proximal to the group sitting around the table and on the call. What we're really asking for help on is thinking through how do we get to those families who are, migrant families, people working, teen moms, homeless families. We're thinking about people are really hard to get to. So that's why we might not hear that today, but absolutely that is the intent. I wonder if anyone else want to say anything else about that. First question.
No,
Okay,
I agree with everything you said, and I'm happy to take the second question. So, am I understanding correctly that there's currently no plan for focus groups or direct connection with informal, licensed, exempt providers, but you'll be gathering information from them to inform via survey only? So I would say no, that is not what I was saying. So we will be looking to you all to help us connect with them. So one of our 4 focus groups will absolutely be with early childhood providers. So looking at the best way to get a broad swath of them together to be able to do a focus group and thinking through carefully how that will work. As well as the other piece that I talked about, the proactive engagement, so the more informal focus groups, where we'll be asking you, are there meetings we can join of the Family Child Care Association or other local groups where we can ask some targeted questions and get input? So the survey will certainly supplement that. We know we're moving quickly to do this work, but no, we will be doing focus groups, both formal, informal, with those populations too.
I just want to note there's a thank you from someone for thinking about and focusing on people who don't typically have a voice in these kinds of discussions. So thank you to all of you for really focusing on this.
Yeah, so let's look at some of those questions, but we welcome further questions coming in. Okay, one more is coming in. Would it be possible to add the Colorado Montessori Association as a group? Excellent. So we're starting to look at that list of potential areas to focus and start with. So Martha, I like that you're thinking about that, and let's jump to that in like one slide, I think. But yes, I'm sure that we do want to add that group. So let's think about a way to kind of collect that in a streamlined way. So the questions that we want to focus on, actually, if you mind, sorry, this is perfect. Yeah, this is good. Thank you. So this is what we just had up several slides before where we said, hold tight, here's what we're looking at to ask for your help. On the left-hand side, again, those are the populations, families that we really want to gather input from. And on the column on the right are potential existing groups. Our first go at this is not everybody. So you're going to think, wait, why is this group not here? We couldn't fit it all on the slide. That's really the intent here. We're trying to give some examples of our first thinking on where do we start, who do we start with, so that we can say, what existing parent groups are out there? How do we leverage existing knowledge bases that are out there thinking about these issues? So that's what this list is. We anticipate the discussion today could be focused on, collecting input through the chat. And we also anticipate you may want to take this list and share it with your organizations, with the people that you're kind of representing today, and ask for their feedback as well. So we do want to give you a couple days, only a couple though, because we really want to start the work to start to send us specific names of people, contact people, email addresses or phone numbers, as well as any upcoming meetings, upcoming, facilitated groups that are already coming together that represent in the most comprehensive way possible some of these populations on the left. So perhaps the way we can do this, and Carrie, jump in if you have a different way you'd like to do this, but we can simply say, please use the chat right now. We'll start to sort of read through those and see if other ideas come out in the next, like, just couple minutes. And we'd encourage you to take this list and send it out. Come back to us with your comments, recommendations, and as specific as possible that you can get with people's names, meetings that are coming up, dates, emails, okay? So the specifics you can get, if you can send those directly to me, I'd be happy to facilitate some of that, and we will share that information across the vendors. So we're seeing a couple things coming in, but let me just pause. Carrie, anything else that you wanted to add or different way you want to direct this discussion on family engagement?
No, that's perfect.
All right.
Yep. And as a reminder, we have shared and will continue to share the link to submit meeting dates of these groups. So if they have existing meeting dates, please use that form to submit that information. That's how we prefer to collect it. If you, for some reason, can't find the link or can't access any of us, send it to cdhs_pdg@state.co.us, and then we'll make sure that our partners have that information, that we're calendaring it so that everybody can access that and hopefully plug into those meetings.
Great.
And I'm seeing so many great suggestions coming in, which I think cover both family and provider and partner engagement. So if it's okay, if we go to the next slide, and I'll talk about this, and then we can start talking about some of the things that we see coming in.
Perfect.
So as I mentioned earlier, we have already identified more than 50 agencies, initiatives, work groups that are really focused on providers and partners and systems builders that we want to make sure we talk with. Similar to Alex's slide, we could not fit all of them on here. So this is probably about half of the ones we've identified so far. You can see child care providers are at the top of the list. And so thinking of Colorado Shines, the Colorado Association for the Education of Young Children, the Colorado Association for Family Child Care, the Colorado Early Childhood Education Association. CCAP's not listed on here, but they're on our list. The Head Start Association, which I see is coming through as well, just wrote down the Colorado Montessori Association. So really, I think this top one, and particularly thinking of those who may be more difficult to reach, if they're coming together, or if maybe we need to make sure they're getting a survey with a follow-up phone call or something like that. So really want to make sure that we're thinking, you can see that last line is considerations across all provider and stakeholder groups. We really want to make sure that we have geographic diversity. So looking at urban, rural, and frontier across the state. We want to make sure we have a diversity in age groups served. So infants, toddlers, and pre-K. And we also want to make sure we have cultural linguistic diversity. So I think the more you can help us identify how to connect with some of these more difficult to reach groups to make sure that when we are doing both our formal focus groups as well as our informal or targeted communication where we're joining a meeting, that would be really helpful. And then you can see under early care and education providers, we have other service providers that work across the framework, as well as our systems builders. So thinking about our councils, our home visitors, mental health consultants, physical and behavioral health providers, family strengthening and resource providers, education, human services, public health and healthcare agencies, child protection, economic assistance, employment support, policymakers and advocates, and funders. And so this is no small feat, and we're working to do it very quickly. I'm seeing a lot of things come in, so I will pause for a moment for us to take a look at that and see what feedback you have so far. The Family, Friend, and Neighbor Care Coalition, that is wonderful. We would appreciate a connection with that. So Terry, I'll be reaching out to you. I see the Family, Friend, and Neighbor Strategic Partnership Action Network, Family, Friend, and Neighbor and Licensed Exempt Providers Essential, the Colorado Statewide Parent Coalition's PASP program. My eyesight's being tested here. Let's see here. And then it says, just want to ensure that child care health consultants and school nurses are a target audience for engagement here. This will be an incredibly important group to engage around issues of ensuring that children with special needs are included in early learning settings and are supported through a transition from early learning to K-12. Absolutely. I can't remember if they're on this slide in front of you, but they are definitely on the broader list.
Are you capturing these separately?
Yeah.
Sort of...
So we have access to capture all of these questions or the feedback.
Wonderful.
And so again, we'll be able to share that with everybody following the meeting.
Okay.
Again, great suggestions. We've captured a number of these because our PQA membership has been really responsive to our stakeholder meeting identification tool. But again, I would encourage everybody to give us a little more information by completing that form and helping us identify those meeting dates, because that's going to expedite our ability to calendar these out and develop that outreach plan.
Thank you, Lindsay.
Well, we know people are paying attention.
Yes,
this is
This
wonderful.
is great.
And so I'm seeing the Wild Child Care Committee, the Teach for America Colorado would love to be included within the Employment Support Workforce category. Policymakers and Advocates, the Early Childhood Summit is another group to add to this section, absolutely. And they have some upcoming meetings. So again, as Lindsay is encouraging you, please, the more we can filter it through the link that's already available, again, will help us expedite everything and make sure that we're spreading our team out in the best possible way to get to as many of these meetings as possible.
Yeah. And also note that within the OEC, we've cultivated a really great preschool development grant team. And we're also deploying those individuals to help supplant the work of our partners. So you may see Kristen, Abilene, Angela, Lisa attending your meetings. They're really there intentionally to ensure alignment and information is being collected and fed back as well. So you may not see Morgan or Alex show up, but we definitely are trying to expand our reach to make sure that we are collecting information from these spaces.
Absolutely. And that's, I can't emphasize enough how we're all meeting weekly and talking through what's happening, because it's absolutely going to be a divide and conquer to make sure we're getting as many voices as possible.
So we'll send out the link again for folks. You should have received that link many times with the emails that have come out either from myself, Christina, or from Amanda. But we will go ahead and send that out again after this meeting to make sure everybody has it front and center. And we've got just a few more minutes here before we switch over to the analytics and evaluation discussion. So I just want to pause and see if folks have other questions, comments, ideas, things that are gaps, reactions. So you've heard a lot of information about the needs assessment work and the strategic plan work from our awesome vendors here with us today. What do you think? And sort of let's take a few minutes and have folks either write those into the chat or let us know you want to be unmuted and we can unmute you individually. But you sort of, this is some really great access we have to these two vendors together, or multiple vendors around the needs assessment and strategic plan. So please ask questions. What's on your mind? So let's give folks just a minute or two.
I know there was that, the question up here about ensuring survey responses, including people with limited access to technology. Should we spend a second about that? It's a great question. And it looks like maybe other people still have this question though. The limited access to technology issue is something that we're thinking about, not just for, mostly we're thinking about families who are marginalized, thinking about the homeless population, migrants, people who are not going to have stable housing, for example, or other sort of vulnerable populations. That's absolutely an area of focus for the family engagement process. And as you saw, I think a couple of slides back, we're thinking about a couple of different ways to capture that. One is through the Bright by Text approach, and that's a sort of a technology approach. One is through more of a family data collection tool that may include things like very on the ground people showing up at, you know, a county fair, showing up at service agencies, and using sort of iPad data collection. That's something that we're considering. We're still thinking about sort of a two-pronged approach to that so that we can meet the timeline needs, since that sort of data collection can be really pretty slow and expensive. And so we just need to think about how to balance those things, but that is on our mind. The primary way that I think we'll be able to get those voices is using existing groups and existing service agencies to bring together focus groups of those populations. So I'm envisioning that being a bit more qualitative than using surveys to capture their input, but that it will be a challenge. So we really need your help doing that. Carrie, do you want to add anything else to the non-tech access question or for family engagement?
Yeah, I mean, it's definitely a great question. And I think just to echo then what Alex was saying is we're going to just rely on the focus groups from our perspective on our side to try to reach those populations and really rely on you all, the PQA and others who may not be involved in this group to help connect us to those groups and help us pull those groups together. As everybody knows, it's always a challenge to pull parents together who have very busy schedules, multiple jobs, children, and so we're going to try to provide, of course, childcare for the focus groups as well as refreshments. So we're really trying to make it as easy as possible to participate to the extent that we can within our time constraints.
And then I would just add from the provider perspective, knowing many family child care providers and informal care providers may have similar issues, even if they have technology access, depending on where they are in the state, it may be a little bit slower, or they may not have the same type of time to actually go and check for a survey. And so that's where we're really thinking of that box that I was talking about, proactive engagement, where we're really going to want to understand who are the trusted partners already. So being very thoughtful about the fact that we're going to need to partner with those who are already trusted and already convening them, which is versus trying to partner on our own. So I think, the more you know about those informal caregivers and who they're already trusting and when they're already convening, that we could join would be really helpful information for us. Let's see, it looks like we have a comment about really glad to see the engagement of partners who represent health and well-being. Wonderful. Yes, when thinking of other service providers, we absolutely want to make sure that we're thinking about all domains across the early childhood framework. And then as the vendor team responsible for the Maximize Parent Choice communications piece, oh great, this is Catherine Brenton from SE2. She just wants to hear how this team's thoughts off the cuff on how the strategic communications planning, including message development, partner training and dissemination, should intersect with this work. Particularly interested in your thoughts on timing for these activities to ensure we benefit from the insights from the strategic plan and needs assessment. And I will say, Catherine, we would love to talk more with you about it. We've already started, we have weekly meetings with a needs assessment team because we were thinking the same thing across our two teams, and would love to include you in those. I think it's important once we have this list of all the different dates and the different groups we're trying to identify to really think across all of our vendors to see how we can accomplish that as well as OEC. Lindsay, do you have anything to add?
Yeah, I would add. So Catherine, our initial findings we're anticipating around October, and so in terms of what they find that would feed into the parent choice no wrong door strategy is probably going to be shared around that time, I would imagine. So I think that there's other activities that we can talk about that would be important for you to do, but a big bulk of what you would learn from needs assessment and strategic planning won't come until October.
Thank you. What about sending a survey to all ECE providers who have families to have families fill out at the place of care.
Oh, thank you. Okay.
Mhm.
Great idea.
Yeah, it's a great idea. I mean, that's one of the ways we're thinking about sort of distributing. I give that example of like county fairs and that sort of thing. This is an initial idea, but we're trying to think of like boots on the ground ways of getting some face time with families. And that's one way that we could ask for help. So thank you.
Will the meetings be able to attend meetings held at different times of the day, days of the week, host focus groups in different languages? Absolutely.
Yeah.
Critical consideration.
Yeah, and I'll speak to that just since we were thinking about sort of translation, childcare, access to transportation to these particularly family groups. That is absolutely something that we're thinking about. We're thinking about incentives, offering food. So that's something on our mind. So accessibility, I'm glad that you were thinking about that too.
Yeah, again, I don't think that the feds have said without any hesitation that this is all about family voice. And so they've really expanded limitations on our funding and our timelines and our capacity to do things to ensure that we are doing everything in our power to elevate that voice.
And Lindsay, just so that we can give some clarity to everybody, I know we have up here my contact information, but I do want to be clear about like how we're sort of diverging between the form, and that's really important that we use that. I think that form or do you want to say anything about that, about how you want to divert some comments coming to the vendors versus the comments that we want to make sure are coming through in a really standard way?
Yeah, I think our preference would be to be able to collect all of that meeting and stakeholder information through the form or through the PDG email address. And the reason I say that is, again, because it's not just our vendors who are going out and engaging with these communities. We also have an internal team that's going to help kind of fill in some of these gaps and expand in areas that may not be the focus or within the primary scope of our needs assessment strategic plan. So it's important for us to have an awareness of that too, and to make sure that we can engage as well. Additionally, if you do have information, again, any plans that you're developing now or have recently developed, data that you've collected recently, or reports, make sure that you're sharing those as well. Again, we've set up forms for individuals to submit that. The forms do provide opportunities to kind of frame what you're submitting, which allows us, again, to expedite how we review and include those findings. So it's really important to us to be able to support our vendors in a way that's really efficient and effective and not just bombarding them with information. And so the OEC is taking on that responsibility. So we'll make sure that all of those links are shared right after this meeting. And again, if there are questions outside of that, be sure to reach out to our PDG email address or team members if you have our information, and we're happy to facilitate those connects.
Thank you.
Okay. So just to put a clear point on it, since it's my email address, I want to make sure there's clarity. So let's not really use basically input through the vendors. I think that's what I'm hearing. And we can certainly help direct that, but I welcome people's questions and stuff, but I think that what I'm hearing is let's really funnel those comments and questions and input through the existing channels. So
yes, it just allows us to be a little more efficient in facilitating that information and organizing it in a way that doesn't overwhelm you.
Yeah. Perfect.
I would still encourage, though I don't know what the deadline for that is, but we would love for a lot of that information to come in by Friday, June 21st, so that OEC can get it to us and we can hit the ground running.
Yes, I think the current deadline is tomorrow.
Oh, is it?
Even better.
Even better. That's wonderful.
We send it to the 21st to account for any, light bulbs that turned on during this meeting.
Thank you.
All right, wonderful. Well, thank you all so much. We'll make sure that we share the information and the questions that were provided today with our vendors. So thank you. Feel free to continue to write in anything in the chat that you want to either share or any questions that come up along the way. And now I think we are going to switch over to an overview of our analytics and evaluation strategies. So we've got a few folks on the phone, I think, that are going to be leading that for us. Meg and Amy. Meg, are you leading the first section here? Amy, are you leading the first section?
Yes, I am. Can you hear me okay?
All right. We can hear you.
Great, great.
And let's see real quick if we can make you the presenter. If you
Okay.
want to just give us one. If it's easier, we're happy to run the slides from here.
Yeah, I'm fine with you all running the slides. That totally works for me.
Okay. Why don't we do that, and then just let us know, and we'll jump over to the next slide for you.
Okay, great. Thank you. Good morning, everyone. This is Amy Roberts. I'm a Senior Research Associate at the Butler Institute for Families at the University of Denver. And I'm going to be talking about the analytics project, which, as Lindsay mentioned, is part of the Sharing Best Practices activity within the PDG grant. If we could advance to the next slide, please. Next slide. Thanks. The purpose of this project is to collect and analyze data which will inform a long-term training and technical assistance plan for the Colorado Office of Early Childhood. And next slide, please. And the way we'll be accomplishing this is through a variety of surveys and administrative data analysis. And I'll pause here to say that we have been in touch with the other teams, and so really thinking about not duplicating efforts here and making sure we're aligning, and in particular not overly taxing stakeholders in gathering feedback and input. So I wanted to say that in advance. The surveys that we'll be administering are to a variety of stakeholders, including Colorado Shine's providers, coaches and quality improvement navigators, as well as families. And I'll be walking through each of these in a moment. And the administrative data analysis will focus on Colorado Shine's QRIS and PDIS databases, as well as child care licensing data and help desk tickets. Next slide, thank you. The provider survey will be administered to all Colorado Shine's providers across levels and will include a broad, comprehensive survey, which will include demographics and program characteristics, knowledge of the Colorado Shine's QRIS, perceptions and beliefs about Colorado Shine's and desire to move up in level, how providers teach and track student learning, as well as desired training and perceived access to training. This will be accomplished through mostly online surveys. We will use paper if needed, and surveys will be administered in both English and Spanish. The coach and quality improvement navigator surveys will be administered to all coaches and navigators that are part of the Colorado Shines. This survey will include a variety of job characteristics such as experience, roles and responsibilities, salary and benefits, as well as training and support that is received and desired, the outreach and engagement that they have with providers, who quality navigators collaborate with, and their views of the program. This, again, will be accomplished through online surveys, paper as needed, in English and Spanish. Next slide, please. Thank you. The final piece of the primary data collection will be a family survey, specifically focused on CCAP families. We will draw a stratified random sample of approximately 1,500 CCAP families to focus on their views of the CCAP application process, their awareness of Colorado Shine's quality ratings, how they're using quality ratings in finding care, access to preferred child care arrangements, how their CCAP eligibility is changing, and the perceived impacts of participation in CCAP. Similarly, this will be accomplished through paper and online surveys, and again in English and Spanish. Shifting gears slightly, the administrative data that we'll be leveraging, first, the Colorado Shine's QRIS data, specifically levels 3 through 5, to focus in on sub-indicators, areas that seem like need to be prioritized for technical assistance and training for providers, as well as the PDIS competency data to identify the areas of need, again, the lowest rated competencies, and to the extent we can, to analyze relationships among the competencies and classroom quality, as well as how PDIS e-learning courses are predicting, participation in those courses are predicting competency ratings. And then the last two databases we'll be leveraging here are the childcare licensing data and the help desk ticket data. In terms of the childcare licensing, we will focus in on the areas that are most common in terms of incidences and types of violations that occur, and to the extent we can, linking back with the data on competencies to identify how competencies of administrators are associated with the most common violations. And then finally, help desk tickets will focus on a variety of things, but big picture is to identify the most common questions that are posed by providers when they seek help. The timeline for accomplishing these tasks is shown here. So first, going through the areas of primary data collection, which includes the coach, navigator, provider, and family surveys. We will be developing and obtaining the secondary data needed to accomplish these tasks in the current month as well as July, administering the survey in August and September, working towards analyzing the data in October and November with a focus on dissemination and report writing in December. The administrative data specifically follows a somewhat similar timeline. We will be obtaining the secondary data in the next few months, analyzing those data during the summer and early fall, into the fall, and then again disseminating and report writing in December. Okay, so the Butler Institute for Families is the lead agency on this project. The team at Butler includes myself, as well as Meg Franco as co-PI, Ann Wacker, who is a senior research associate with us, Anthony Molieri, who is a project manager focused on this project, and Selena Leone, who is the research coordinator. Our team will be focusing on client coordination, the fiscal, logistical, and administrative oversight involved in this project, and we will be administering the surveys, analyzing, and we will be leading the reporting portion. We have really great partners engaged in this work, including V. Nguyen Lee, who is at NORC at the University of Chicago. V will be facilitating the secure data transfer. She'll be really focusing on the secondary data, the administrative databases, to advise on and lead statistical analyses, and she will be contributing to dissemination. We also have Diana Schack, who is at the University of Colorado, Denver. She will be consulting with us to contribute to the development of measures and data collection instruments. Okay, so I'm going to hand it over to Meg unless we have questions before we do, but Meg will be leading the evaluation planning portion.
Hi, everybody. This is Meg Franco. I'm the Director of Research and Evaluation at the Butler Institute, and working with Amy, as you saw, on the evaluation planning for the Colorado Shines Brighter work. We are also working with NORC, again, V. Nguyen Lee with the NORC out of the University of Chicago, and with Andrew Brodsky from Brodsky Research and Consulting. Thanks. If you can move to the next slide. The purpose of the evaluation planning is really to set out a game plan for how to evaluate whatever activities the state decides to pursue as a result of all the great work that the needs assessment and the strategic plan efforts are going to come up with. So they're really reliant, this product is really reliant on what happens with the strategic planning and the needs assessment, and close collaboration with the folks at OEC. So there are going to be three components to the evaluation plan. We're going to be looking at putting together a process evaluation to really understand how any initiatives or activities that are implemented the approach to doing those, the state can understand how well those things are being done once they put those into place. A cost evaluation that will be looking at what it sounds like, the cost and fiscal implications of any activities that the state moves forward. And finally, an outcome evaluation to really look at what difference the activities make for the system and for children that are served by the system. And we've broken down these 3 different processes across the evaluation team. Butler is really going to take the lead on the process evaluation. Andrew Brodsky, who has a strong background in economic analysis in the early care and education arena, will be taking the lead on the cost evaluation, and V will be doing a lot of the analysis and lead for the outcome evaluation. Next slide. So we're taking a similar approach across all 3 of those process, cost, and outcome components. We're going to be doing, spending the first couple of months really focused on review of what currently exists, both in terms of, well, I'll go into more detail in a minute. So we'll be focusing first on review, then on refining any existing research questions and planning evaluation plan strategies that were in the initial PDG application. We're going to identify new research questions, new methodological approaches where appropriate, and any gaps that need to be filled in to be able to evaluate the work. We'll articulate a new plan, and finally, we're going to work with OEC to help create any new tools and measures that need to be put in place in order to carry out the evaluation. Next slide. Thanks. So in the review phase, again, we're really going to be looking at existing research questions that the state put forward in their PDG application, and also working with the state to understand how some of those research questions may be shifting for them as new information comes in through the just the implementation of this initiative and through the needs assessment and strategic planning. We're going to be looking at data sources that we anticipate may be good data sources for answering research questions, to really see what the integrity of the data is, and whether, whether there's large amounts of missing data, that sort of thing, so we can understand what's feasible to be proposing in the evaluation plan for using moving forward. And then reviewing current evaluation plan activities and literature that might inform methodological approaches. Next slide. In the refining stage, we're going to collaborate closely with both the Colorado Shines Brighter evaluation team at OEC and also the needs assessment and strategic plan vendors to really understand what the information is telling us from the work that the other vendors are doing, and to use that information to refine and make new research questions and activities, along with figuring out how those would be evaluated. Next slide. And then we'll move into really identifying exactly what the evaluation approach should be and what are reasonable samples for us or for the evaluation ultimately to be drawing from. We'll work closely on exactly how that data collection should take place and really help articulate that, identify appropriate analytical procedures for answering different research questions, and identify ways that any resulting evaluation information can be disseminated out to the stakeholders and other end users once evaluation results start to come in. Next slide. Ultimately, we're going to prepare written documentation that really pulls all of this together. The most important part of this, I think, is that OEC be able to use this evaluation plan as part of their continuing funding for application for the PDG monies. So that's really the next, or our target is to be able to give them and all of you something that really can be used for that application. Next slide. And as I mentioned, we will be working to develop any new tools or protocols that might be necessary for any primary data collection that we propose as part of the evaluation, so that once OEC is awarded the next 2 to 4 years, which I have great confidence they will be, they have the tools that they need to go ahead and launch into the evaluation quickly. Next slide. So our timeline is, we are very grateful our timeline has been moved because of some of the changes with the federal timing, that we will have through December to get some of this work done. As I mentioned, we're going to really be tying in a lot of the work of the needs assessment and the strategic plan in order to create this evaluation plan. So you'll see on this timeline that during July and August in particular, much of our work will concentrate on that review part of the scope that I talked about. And then we'll move into more of the refining and identifying and articulating kinds of activities moving into the fall. So we'll be attending the weekly meetings that the needs assessment and strategic planning group have on a regular basis, and collaborating and meeting closely with the OEC team so that we're really up to speed with what is happening and the results and kind of information and learnings that are coming into those teams, so that we can really hit the ground running in terms of putting together the evaluation plan in a timely manner so that it's ready to go with the application. Next slide. I mentioned a little bit before who's involved for putting together the evaluation plan. Butler is the lead agency for this. I am the principal investigator and working with Amy as the co-principal investigator. Larisha Longworth-Reed is a senior research associate with Butler and will be taking on a lot of this work as well. We will be leading the process evaluation and in charge of client coordination and fiscal, logistical, and administrative oversight. Just as with the analytics, we're working closely with our partner Vinwan Lee at NORC, who has some just outstanding, amazing statistical skills, and we're thrilled to be, collaborating with her, and she'll take the lead on the outcome evaluation plan. And again, Andrew Brodsky, who's got a great reputation, and I've worked with him before on cost and economic evaluation, will lead the cost side of the planning. And I think that's it, unless you go one more slide and I have anything else. No? Okay.
Looks like that's your last slide. So okay. Yeah, thank you.
I wasn't totally sure.
Well, thank you both for sharing that with us. I wanted to see and pause for a second if there are any questions or comments or thoughts from folks as we hear about the plan around understanding the analytics and then the evaluation of the different components that'll be moving forward. Any questions, things to add? Looking at our question box and our chat box, I don't see anything. All right. Well, feel free, folks, to continue to type things in if you do have comments or questions, but thank you both for presenting. All right, so this is Christina again, and I wanted to just give us a quick update around summits. We talked about this a little while back, that we built into the Program Quality and Alignment Subcommittee, this group, built in some capacity and some funding for us to host up to 2 different summits. And we were sort of vague in terms of what those would be and what the topics would be and who the audiences would be, because we really wanted to hear from the vendors and understand what their plans were, so that anything that we did to either help share information or ask for feedback or anything like that really aligned and didn't duplicate with any of the work that they would be doing. So we've had a couple phone calls, so thank you to the group members that have participated in those and are helping us think through these. A couple of the pieces, again, we talked about with those small groups, we really don't want to duplicate or add additional components or pieces to the work of the vendors that you just heard from. But we did want to see if there was a need for any other gaps or opportunities to bring the information that we're learning to other groups or other populations, or folks who aren't involved in any of these pieces along the way, or maybe didn't get a chance to participate in the focus groups or things like that. So another component that came up on our calls is that there could be an opportunity to use these summits to think about closing the loop or coming back to those folks that did participate along the way to say, this is what we're hearing, this is what we're learning, and this is the direction that we're planning to go with that final needs assessment report and strategic plan. So I just wanted to share that our small group has met. We're still thinking about how do we connect, but I think we got a lot more information today around the audiences and the populations that our vendors will be reaching out to. So we'll go back to that small group and really think about what's the most meaningful way that we can use these up to 2 summits to be complementary and help support the work along the way and make sure that we're reaching a really broad audience. One note I just wanted to say that folks on the 2 calls that we had really brought up is that there's a desire for us to be outside of Denver too. So if we hold these, maybe we can get outside the Front Range. And I think you heard from our vendors too, that importance on geographic reach and diversity. And so just really excited that we're all moving in the same direction on all that and sharing those values of just bringing those voices to the table that we don't always get to hear from, and making sure that we're really diverse in who we're reaching. So more to come on sort of the purpose and the goals of those summits, but I just wanted to give an update since we talked about those in the past. All right, so for the next section, I want to move on to public comment and any member updates. So again, this is a chance for people to share things that are going on, notes, meetings, events, anything that would be valuable for this whole group to hear about or to learn about. You can either put those into the chat or the question box now, or type your name in and let us know that you want to be unmuted and we can unmute you. So let's just give a couple seconds here for any public comment or any updates that people want to share with the whole group. I don't see anything coming in. Okay. Well, do continue to share those. If you have anything that you want to share with our whole group after, feel free to send that to Amanda or to myself, and we'll, oh, we did get one. Just a comment from someone, from Terry. This has been a very robust meeting, and I appreciate the content. So, and I would absolutely echo that. Thank you to all of you for coming and sharing with us, for those of you on the line, and to our vendors here that came in the room. We do have an update here from Heidi McCaslin with the Colorado Department of Education that there are 5 openings to membership on the Preschool Special Education Advisory Committee within CDE, within the Department of Education. There's specific stakeholder groups that are needed to fill those different positions, as well as geographic regions. So Heidi, and you did share that application with me. I'm happy to send that around to the group so that you can share that with folks who might fill some of those categories or might have an interest in joining that. And again, that's the Preschool Special Education Advisory Committee. So thank you for sharing that, Heidi. All right, and one more comment. Thank you, Karen. Appreciate the chance to hear from all the different teams, and just really, really excited to hear how I think if we think back from January and February, we were saying we're going to have a team in place and we're going to have vendors on board, and there's a lot of work and we'll have money, we're pretty sure, and we'll have a budget. To are now in just a few months with really having a rock star team put together and a really solid plan to get us to that finish line by the end of the year. So kudos to everybody that's been working on that, and thanks for sharing all that with us today.
And I would say thank you to the PQA members.
Absolutely.
Your feedback has really shaped the direction that we've taken to this point, and again, you continue to play a really valuable role in this work.
Absolutely. Thank you all again for coming, for being a part, for speaking, for sharing your thoughts and places for us to go. It's been incredibly valuable. All right, I will jump to the next part of the agenda here then. We always ask for agenda topics or future meeting ideas for us to share. As a reminder, we hold these webinars that are just focused on the preschool development grants every other month. And then on the other months, we have meetings in person where we talk about preschool development grant, but we also see if there are other topics or issues or presentations that help us continue the work of the Program Quality and Alignment Subcommittee. So if you have ideas or thoughts, please either share those into the chat box or send those to us after the meeting. We'd love to hear those. And then final note for today, if you can jump to the next slide. So for our next meeting will be July 12th. We'll be at a new location. You'll notice we've been moving these around a little bit to see where we can fit all of us in the room and have the best audio and visual capabilities. So this meeting on July 12th, we're going to be at the State Services Building. That's 1 block north of the state capitol for folks in Denver. It's at 1525 Sherman. We will have the webinar capabilities as well and conference line. We'll also make sure that those are recorded and share that after the meeting. I wanted to make 2 notes about that location. One, there is some security to get through into that conference room, so if folks can plan into their schedule to be there a couple minutes early to get through that. And then the second piece, we know that it's 2-hour parking all around us, and so we'll try and have the meeting end 10 minutes early so folks can get back to their cars. So if you want to plan that in for that meeting, we'd love to have you there on the 12th. All right, if there are no more thoughts or questions, I think we will end here, and thank you all for joining us. Have a great Friday.